Hello guys, welcome and welcome to Media Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And today we are going to focus on SGPGI exam. Yes guys, February 18 SGPGI exam is going to be there, and this is the right time to discuss the previous year question papers. It will be very easy to solve the question if you keep on do the revision, if you keep on understand the rationale behind each and every options. So this is the right time to do the revision of previous year question papers. In keeping that in mind, we started the previous year question paper discussions. Without wasting time, let's begin the session. Question number 51. T wave in the ECG graph represent T wave. Okay. And here they have given the option ventricular depolarization, atrial depolarization, ventricular repolarization, atrial repolarization. First, you should know the meaning of depolarization and repolarization. Depolarization means contraction and repolarization means relaxation. Depolarization means what? The contraction is going to be taken place and repolarization, relaxation is going to take place. Okay, fine. So now we can go to the ECG rhythm. This is P, this is Q or S, and this is T. P, Q or S, T. This is the ECG rhythm. This P wave is responsible for atrial contraction. Atrial contraction. QRS is responsible for ventricular contraction. And T wave is responsible for ventricular relaxation. Okay. So in the question what they asked, T wave in the ECG represent what? It represent ventricular relaxation, also called as ventricular repolarization. So the right answer here is option C. Okay, so let's move on to the next question. Which diagnostic test can measure the size and ejection fraction of the heart? Okay, so here the keyword what you supposed to note is the test to measure the size of the heart. That is the first keyword. Second keyword is ejection fraction of the heart. Okay, so how we will measure the size of the heart? Four options they have given here: ECG, echocardiography, treadmill test, barium swallow. So these are all the four options. So among these four options, the diagnostic test to measure the size of the heart is option B, that is echocardiography. Not only size of the heart, we can also see the ejection fraction of the heart. What is ejection fraction? Ejection fraction is nothing but the percentage of blood pumped out from the left ventricle in each heartbeat. The amount of blood pumped out from the left ventricle in each heartbeat. Okay, so that is called as what? Ejection fraction. And the normal ejection fraction is 50 to 70% according to American Heart Association. Okay, AHA. According to AHA, the normal ejection fraction is 50 to 70% if for a healthy adult. Okay, in case of diseased means it will be less than 50. Fine. Okay, and there is one more important golden point in ejection fraction, that is formula. Most commonly only these questions will be asked in the exam. So what is ejection fraction? Amount of blood or percentage of blood pumped out from the heart from the left ventricle in each heartbeat. Okay, that is ejection fraction. And second one is, what is the normal ejection fraction? 50 to 70%. And third one is, they will ask the formula for ejection fraction. The formula for ejection fraction is equal to stroke volume divided by end diastolic volume into 100. Okay, so this is the formula for ejection fraction. Let's move on to the next. Next question is, after cardiac catheterization, immediate priority nursing intervention is. Here the keyword is after the cardiac catheterization, the priority nursing intervention. Here they are asking about the priority. So usually if they are asking about priority means all the four options it will be right. But among the four options we have to select the priority one. Okay. So what we will do here, four options they have given: check for the distal pulses and bleeding from site, provide bed rest for 4 to 6 hours and move the extremities every hourly, ensure patient safety by helping him get out of the bed, instruct to drink adequate fluid to rush out the contrast agent if used. Okay, so all are very important after the cardiac catheterization, but still the priority one what we supposed to give is A, that is check the distal pulses, because cardiac catheterization means they will select either radial pulse or the femoral pulse and they will insert the guide wire and catheter in order to do the cardiac catheterization. Fine. So once they did the cardiac catheterization, they will remove the guide wire and they will remove the catheter, and then you have to check for the pulse distal to that area. For example, if they use the femoral artery, means the pulse which is distal to the femoral artery, okay, that we have to check. Along with that, we have to check for the bleeding, because femoral artery the pressure is going to be more, so there is a more chance for what, bleeding. So you have to check for what, bleeding also. So that's why we selected option A. And the next question is question number 54. Osler node and Janeway lesion or manifestations of. Very important, frequently asked question. Osler nodes and Janeway lesions. These are all the two keywords, and it is a direct question, and here the answer is option B, that is endocarditis. Okay, so what is Osler node and what is Janeway node? These are all the cutaneous manifestations of endocarditis. What is the meaning of cutaneous? The cutaneous means skin. Cutaneous means what? Skin. Okay, so you can see the manifestations, signs and symptoms in the skin. That is called as cutaneous manifestation of the endocarditis. So what will happen here? In Osler's nodes, okay, you can see the pea-sized erythematous tender nodules. The tender in the sense painful. This is very important, guys. Painful nodules will be present on the fingers and toes. Okay, in Osler nodules or Osler nodes, painful pea-shaped nodes will be present. Okay, whereas in Janeway lesion, non-painful nodules or non-painful macules seen on the palms and the soles. Okay, what type? Non-painful macules which is seen on the palms and soles. Osler node, finger and toe, and Janeway lesions, palms and soles. Osler node, painful, Janeway lesion, non-painful. And these two are the manifestation, that is cutaneous manifestation of endocarditis. So the right answer here is option B. And the next one is question number 55. With aging, what is that? With aging, the blood pressure is often higher due to. So here what they are asking is, with aging, when the aging is increased, when the age is increased, the blood pressure is increasing. Why it is increasing? And they have given four options: loss of muscle mass, change in exercise and diet, decreased peripheral resistance, decreased elasticity in the arterial wall. This is the direct question already asked in the exams. Okay, so here the right answer is option D, that is loss of elasticity in the arterial walls. Okay, severe spasm will take place, whereas the relaxation is not taking place. Okay, that's why with aging the blood pressure is often rising. The next one, question number 56. People with mechanical valve require to take this medication lifelong. So here what they are saying, there is a mechanical valve. Mechanical valve is the keyword here. So when they will do the mechanical valve or valvular replacement in the heart, if there is some stenosis or atrophy in the mitral valve or tricuspid valve or semilunar valves which is present within the heart, so they will do what? Valvular replacement. So mechanical valve will be present, that is artificial valve will be present. For this patient, what medications has to be taken lifelong? Lifelong medications they are asking. And here four options they have mentioned: antipyretic, analgesic, anticoagulant and antibiotics. And here the right answer is option C, that is anticoagulant. Lifelong the person has to take the anticoagulant to prevent the thrombus formation and emboli formation, because the person who underwent mechanical valve, the valvular replacement, those peoples are prone for thrombus and emboli formation. So what they are supposed to take? Anticoagulant has to be taken lifelong. And the next one is Which of the following sign is positive in deep vein thrombosis? So positive deep vein thrombosis sign. It is very simple question. Four sign they have given here: Homan sign, Jacobian sign, Kerning sign, Heger sign. In deep vein thrombosis means what? See, dorsiflexion of your foot will cause pain in the calf muscles. If there is a DVT, deep vein thrombosis, the examiner will do dorsiflexion of the foot. When there is a dorsiflexion of the foot, immediately there will be a pain in the calf muscle. That is called as what? Homan sign. So here the right answer is what? Option A, Homan sign. What about other options? See, in option B, you can see Jacobian sign. See, Jacobian sign is also called as what? Chadwick sign. What sign? Chadwick sign. What is that Chadwick sign? See, Jacobian sign or Chadwick sign is nothing but dusky view or else purplish discoloration of the mucous membrane of the vagina. Jacobian sign means what? Dusky hue or purplish discoloration of the mucous membrane of the vagina. Okay, usually seen in the early pregnancy stage, in the 8th weeks of pregnancy. So that is called as Jacobian sign. What about Kerning sign? It is seen in infection in the meninges. In meningitis, you can see what? Kerning sign, Rudzinski sign, knuckle rigidity. These three things are the classical signs of meningitis, right? So Kerning sign is one of the classical sign of meningitis. So it is not related to DVT. Heger sign, it is also a sign of early pregnancy. So what will happen in the Heger sign? Softening of the cervix. Softening of the cervix will take place. Okay, softening of the cervix in the lower segment of the uterus. That is the key word, lower segment of the uterus. Okay, and it happens in the 12th week of gestation. So Jacobian sign is related to early pregnancy, Heger sign is related to early pregnancy, Kerning sign is related to meningitis, and the leftover is Homan sign. And question number 58, which of the following cardiac rhythm is non-shockable? Already we discussed many times about shockable rhythm and non-shockable rhythm. Only two are shockable rhythm. This is shockable rhythm and this is non-shockable rhythm. See, shockable rhythm means immediately you have to think about pulseless ventricular tachycardia and ventricular fibrillation. Okay, and non-shockable rhythm means pulseless electrical activity and asystole. Asystole. Okay, see, in these two things, if you are giving shock also, no use at all. So it is considered as what? Non-shockable rhythm. Whereas if you are giving the shock, you can restart the heart in pulseless ventricular tachycardia and ventricular fibrillation. So these two conditions is coming under what? Shockable rhythm. So we can go to the options here. Four options they have given in question number 58, that is ventricular tachycardia, ventricular fibrillation, pulseless electrical activity and pulseless ventricular tachycardia. So non-shockable rhythm means here the right answer is option C, that is pulseless electrical activity. And other things like, ventricular fibrillation, ventricular tachycardia, pulseless ventricular tachycardia, we can give the shock. Okay, fine. And question number 59, which of the following represent the full form of AED? It is very simple one, that is automated external defibrillator. AED means what? Automated external defibrillator. In this, many cardiac related questions were asked. Okay, so for question number 59, the right answer is option D, AED. The full form is automated external defibrillator. And the question number 60, the inotropic medication primarily. Inotropics means what? Atropine, adrenaline, noradrenaline. Okay, so these things are coming under what? Inotropes, the life-saving drugs. Okay, so these drugs primarily what it will do? It will increase the force of contraction of the heart. Okay, the main thing is preventing the brain death and cardiac death. So what we supposed to do if the person is in any kind of decreased in the vital signs, immediately we will be going for what? Adrenaline, noradrenaline. These are all the inotropic drugs. What it will do? It will increase the contraction of the heart. That is the first priority. Okay. The next one is question number 61. Which of the following ECG finding alert the nurse that the client needs an antiarrhythmic? Okay, here the keyword is the ECG finding which alerts the nurse that the client needs antiarrhythmic drugs. Okay, so here let's see the options: sinus rhythm, sinus bradycardia, sinus arrhythmias, frequent ventricular atrophy. For a normal sinus rhythm, we doesn't need any antiarrhythmic. Sinus bradycardia, it is a normal one. It will recover on its own. Sinus arrhythmias, for that antiarrhythmic is not that much essential when compared to frequent ventricular ectopy. See, frequent ventricular ectopy is the other name of premature ventricular contractions. Premature ventricular contraction. You can see this is the normal P, QRST. Okay, again P, QRST. This is the R interval. Fine. So if you, this is the normal one. This is the normal one. In case of premature ventricular contraction, you can see the ECG waves. It will be very short. The RR interval is going to be very short. Okay. So this is what happening in the premature ventricular contraction or frequent ventricular ectopy. So when the client need antiarrhythmic drugs, in case of frequent ventricular ectopy, the client needs an antiarrhythmic drugs. Okay, and question number 62, a nurse has performed an ECG. At the time of interpretation, she found that it is a normal sinus rhythm. The normal duration of QRS complex is, here actually they are asking for QRS complex in their normal sinus rhythm ECG. And here the right answer is option A. It is a direct question, so memory based question. So here the direct answer is 0.08 to 0.10 seconds. Option A is the right one. And question number 63, the nurse need to inform the cardiac surgeon immediately when she observe which one of the following parameter during the first postoperative day of the patient who has undergone coronary artery bypass graft. Here the question is, the patient is in first postoperative day after the coronary artery bypass graft. If she monitor which among the four, immediately it has to be informed to the doctor. And here let's see one by one. The urine output is less than 0.5 ml per kg per hour. So this is the abnormal finding. Am I right? So what is the normal urine output? 0.5 ml to 1.5 ml per kg per hour. This is the normal one. 0.5 to 1.5 ml per kg per hour. This is the normal one. Whereas here what is happening? The urine output is less than 0.5 ml per hour per kg. Means the kidney is not getting adequate amount of blood supply. So the urine output is less. Understand? So immediately this information has to be informed to the doctor. Whereas the temperature of 99 degree Fahrenheit in the first postoperative day is very normal. Chest drainage of 100 ml per hour over 4 to 6 hours. It is a long duration. In that 100 ml per hour is a normal one. Discomfort at the incision site is also a normal one. Whereas urine output less than 0.5 ml per kg per hour is a abnormal one. So here the right answer is option A. And question number 64, a patient reports that he experiences chest pain whenever he performs activity. So this is the keyword, chest pain while performing the activity and not relieved by the rest. Very simple and direct question. Okay, and here they have given 4 options, that is unstable angina, stable angina, variant angina, principal angina. So let's see what is the correct answer. See, unstable angina. What is unstable angina? Always consider unstable angina as a medical emergency. Why we need to consider like that? Because in unstable angina, the pain occurs at the rest. Pain occurs at the rest. Even the person is doing the minimal activity, the pain will increase. Okay, it is not at all relieved by the rest as well as it is not relieved by the medications. Okay, so unstable angina is considered as what? Medical emergency. Okay, so this is the right answer. Here the patient is experiencing chest pain while performing the activity and not relieved by the rest means not relieved by the rest. That word if you are seeing means immediately you have to go for what? Unstable angina. The option A is the right one. And other options like stable angina, here it is also called as classical angina. What angina? Classical angina. Here usually it will get relieved by rest. If the patient is taking rest, this stable angina will get relieved, or if the person is taking medication immediately, it will get relieved. Okay, So that is called as stable angina. Variant angina is also called as what? Prince-Metal angina. It is caused because of the spasm of the coronary artery. The coronary artery spasm will be there. Because of that, decreased blood flow to the myocardium. In that situation, the patient will experience Prince-Metal angina. It is also called as variant angina. Usually, they will give NTG, nitroglycerin, to dilate the blood vessel, and adequate blood flow will be maintained in the heart. You can treat that immediately. Okay, so one more important point I would like to add here. Stable angina means it is caused because of atherosclerosis. The etiology factor for stable angina is atherosclerosis. The first important point. And the second important point is the etiological factor for unstable angina is atherosclerosis plus blood clot. Atherosclerosis plus blood clot. And the etiology for variant angina, it is also called as Prince-Metal angina. Already we discussed about the etiology, that is spasm of the coronary artery. Fine guys. So for question number 64, the right answer is option A, that is unstable angina. Next, question number 65. Rheumatic heart disease result from rheumatic fever, which is caused by. See, rheumatic heart disease, it is caused by what? Rheumatic fever. Okay, and rheumatic fever, it is caused by what? Strep throat. Strep throat. Okay, what is strep throat? Strep throat, it is a normal bacterial infection which is caused by group A streptococci. Which streptococci? Group A. This is a very important point. Group A streptococci. Okay, usually this organism is a bacterial organism, and this organism is causing the throat infection, and this condition is called as strep throat. And from there, this organism is entering inside our body, mixing in the bloodstream, reaching the heart. It is causing what? Rheumatic heart disease. So rheumatic heart disease is a bacterial infection. Next one, question number 66. Heart valve affected most by rheumatic fever. Which heart valve affected most by the rheumatic fever? And here the right answer is option B, that is mitral valve. Mitral valve is also called as bicuspid valve. So bicuspid valve is most commonly affected by the rheumatic fever. And question number 67. Diagnostic criteria used for infective endocarditis. Diagnostic criteria which is used for infective endocarditis. So and they have given 4 options: Jones criteria, NIHA classification, Duke's criteria, Rockall criteria. So let's see one by one the rationals. Jones criteria. As you all know, Jones criteria, it is used for what? Rheumatic fever, to identify the rheumatic fever. Okay, so this is the Jones criteria is for what? Rheumatic fever. And next one is NIHA classification. The full form of NIHA is New York Heart Association classification. New York Heart Association. Okay, New York Heart Association classification. So what they will do here they will see the classification of severity of the heart disease. Severity of the heart disease will be seen in the NIHA classification. The next one is Duke's criteria. What is Duke's criteria? It is the diagnostic criteria used for what? Infective endocarditis. Minor criteria, major criteria is there. We will be discussing about that later. At present, the diagnostic criteria used for infective endocarditis is option C, that is Duke's criteria. What about Rockall criteria? Rockall criteria is used for assessing the risk of upper GI bleeding. Upper GI bleeding. What criteria they are using? Rockall score or Rockall criteria. Okay, so on the whole, for question number 67, infective endocarditis, it is assessed by the criteria called as Duke's criteria. Option C is the right one. The next one, question number 68, reticular activating system controls which of the following? It is a direct question. Reticular activating system means immediately you have to think about what? Awareness, consciousness, alertness. Okay, so here you can go for option A. The next question is question number 69. Most used site for test done of medication is. In order to check the test dose of the medication, which site we will use most commonly? Most commonly we will use what? Forearm. This is also a direct question. Answer A is the right one. Okay. And question number 70. Pneumatic bed is used to prevent. What is pneumatic bed? It is a medical air mattress. What mattress? It is a air mattress. TRESS, our mattress, okay, used to prevent the pressure ulcer. So pneumatic bed is nothing but it is a air mattress which is used to prevent what? Pressure ulcer. So here the right answer is option B. Question number 71. A client with Parkinson disease is experiencing anorexia, vomiting since the beginning of the treatment with levodopa. Levodopa is the keyword. What should the initial action as a nurse you supposed to do? So anorexia, either it has to be taken before 1 hour of the food, after 1 hour of the food, okay, and it should not be taken along with the protein rich food. Okay, these are all the keywords, protein rich food. But suppose if the patient is experiencing anorexia and vomiting, if he is taking before the food and after the food, that time he can take the medication along with the food. But make sure the food should not contain high amount of protein, because protein will interfere with the absorption of the levodopa. So you can give the normal food which is not rich in protein, and along with the food you are supposed to give the levodopa medication. So here the right answer for question number 71 is option D. Next one, question number 72. Core body temperature is highest in. 4 options they have given here: early morning, noon, late afternoon, night. First you should know what is the meaning of core body temperature. See, core body temperature is the nothing but the temperature of the internal organs. For example, liver, blood. So all internal organs temperature is collectively called as what? Core temperature. And usually the core temperature will be less in the morning. Less in the morning. Okay, and higher, gradually it will increase in the late afternoon. It will increase in the late afternoon as well as evening. So here the question is, core body temperature is highest in the late afternoon. And if the question, if they are asking like this, less in there or minimum in there, if they are asking like that, means that time the correct answer is early morning. Okay, so here for question number 72 they asked core body temperature is highest in the late afternoon. Option C is the right one. Next one, which of the following is not a cardiac biomarker? Okay, so for this you should know the cardiac enzymes. So what are all the cardiac enzymes? TROP-I, TROP-T, myoglobin, creatinine kinase. These B, C and D are coming under what? Cardiac enzymes. Okay, if there is myocardial infarction, the first and more important test to identify the myocardial infarction, whether the person had injury in the myocardial region, is TROP-I. Okay, so we have to do what? TROP-I test in order to identify the myocardial infarction because of ischemia. Okay, because TROP-I and TROP-T, these two will release in the blood within 2 to 3 hours, whereas creatinine kinase, otherwise CPK-MB, it will release in the blood between 6 to 9 hours. Okay, so we have to go for what? TROP-I when compared to TROP-T. Okay, TROP-I is the accurate measurement of the myocardial infarction. Okay, so in this question what we required is which is not a cardiac biomarker. So here the right answer is option A. Alkaline phosphate is not a cardiac biomarker, whereas creatinine kinase, troponin, myoglobin are the cardiac biomarkers. And question number 74. Here they ask a patient present to the emergency department with the blood pressure of 180 by 130, that is hypertensive crisis. 180 by 130 is a hypertensive crisis. Headache is also there, confusion is also there. So which additional finding is consistent to diagnose the hypertensive crisis? So already there is some hypertensive crisis values are there, but still which one is also there means we can confirm the person is suffering from hypertensive crisis. See, here you should know the complication of hypertensive crisis, that is retinopathy. Okay, so hypertensive, systemic hypertension is there means definitely retinopathy will be there. So if retinopathy is there means we can make sure that the person is suffering from systemic hypertensive crisis. Okay, so here the right answer is option A. And question number 75, this is a wrong question, so we can remove that. Question number 76. Cushing triad refers to set of signs that are indicative of. So in general they are asking what is Cushing triad. What is the set of signs will be there in the Cushing triad. Cushing triad is commonly seen in increased intracranial pressure, guys. What is the normal intracranial pressure? 5 to 15 mm of Hg or mercury. This is the normal intracranial pressure. If there is increased intracranial pressure because of meningitis or cerebral edema, whatever it is, so that time what will happen? Cushing triad manifestations will be there. Triad means 3. Okay, so what are all the manifestations? Increase in the BP, okay, and decrease in the heart rate, decrease in the respiratory rate, or else we can say it as irregular respiratory rate also. So increase BP, decrease heart rate or decrease respiratory rate, together it is called as what? Cushing triad. Okay, and it is seen in increase in the intracranial pressure. So here for question number 76, the right answer here is option D. So this is all about this video. So future one more video in the continuation of the same question paper we will be discussing, okay, soon before the exam. So don't worry about that. So like this, keep on watch our Meteor Nursing Academy YouTube channel previous year question papers. It will be so much useful for you guys to clear the examination. Thank you very much, guys. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon.